United TV. I'm your host, Kamal Erkan. Today we are going to talk about very important and timely discussion that's lining up for us to discuss. As always, I'm joined by our esteemed expert, Dr. Aziz Irga, a leading bariatric surgeon who brings a wealth of knowledge and experience to our conversation. Today, we are going to delve into a topic that has sparked significant debate and discussion across the various platforms. The recent development where Miss Alabama, which actually it turns out that she was not Miss Alabama, was awarded this person who got the Miss Alabama consent. She's at 400 pounds. And this, of course, as the morbid obesity experts and the bariatric program, this actually gets our attention a different way. The reason it is different is because we actually help our patients to go through and fight with this disease. And then when we see other things that's encouraging, in a way, misleading public and normalizing morbid obesity. Of course, we are going to discuss those topics, those issues in this show, and Dr. Irga is going to help me with that. So, Dr. Irga, how are you doing?
I'm doing great, Kamal. Glad to be back for yet another wonderful session of Bariatric Friday.
Well, good to have you back. And last week we have our support group discussions with Dr. Kelvin.
Yep.
And we'll, continue with our regular sessions. So, Dr. Gal, we discussed the social stigma of morbid obesity in different sessions. And in some ways, in some cases, we did it in cooperation with sexual wellness, and then in some cases we shared this one with another social media personality who was, I believe she was in the, what's the guy's name now? I'm blanking. He was on his show.
Oh, yes, the British guy, right?
Piers Morgan.
Piers Morgan,
thank you. Yeah.
Someone is always there to support.
Yeah.
Then
Piers Morgan is not going to be happy you forgot his name. Come on.
That I'm going to leave for the airport in an hour. Now the issue comes back. This time it comes back for a different reason, and the reason is because now one of the Miss pageants in Alabama, actually originally media actually said that she was rewarded as the Miss Alabama, but that's not the case. But before we get to that, I want you to kind of explain morbid obesity, and this is a disease, chronic disease, illness, however people understand this. It's a disease. It's not a hobby. It's not a fashion statement. It's not anything but it's a disease. So I just want you to kind of explain to us one more time to better understand for us to see what we are dealing here.
Right. I mean, from a straightforward definition of a disease, Kamal, morbid obesity fulfills all the criteria we may want to use, right? If you take a disease like diabetes or colon cancer or an arthritis, right? We treat them as diseases because their presence in the body of a person causes harm, right? Causes suffering, but also it's life-threatening. In other words, the persistence of those conditions will lead to an early end of the person's life if those conditions are not treated, right? Morbid obesity is exactly like that. It is. So from our point of view, a person who has morbid obesity, in fact, will have much more severe consequences than many other illnesses that we treat as severe, right? Take, for instance, life expectancy. Take, for instance, the relationship of obesity with many other illnesses, right? In fact, if you were to take the leading causes of mortality in our country, right? Cardiovascular disease, metabolic diseases like diabetes, right? Cancers. All these are actually closely related to obesity. The more obesity you have, the more these illnesses you have, right? So not only it's a disease, but it's the root cause of many very serious diseases that are serious public health problems in our society right now. So from our point of view, we want to shift the conversation from blame to understanding it's a disease. We want to shift the conversation from castigating people who suffer from obesity to sympathizing with them because they are suffering from a condition. Once we shift the conversation in that fashion, we will be able to go away from a lot of the stigmatization that occurs with obesity. Now, the stigmatization of obesity is so severe that is also preventing people from seeking treatment. And I see this day in and day out in my 20 plus years of experience in dealing with morbidly obese patients, Kamal. I see many of them actually ashamed of coming to the surgeon, to the bariatric program, because they say, oh, I should have been able to take care of this by myself. It's all my fault. Everybody points their finger at me because I have been unable to take care of this myself, right? And the comments many of them get from their friends, from their loved ones is, oh, you're going to have bariatric surgery to lose weight? That's the easy way out, right? So really not understanding this problem as a disease, not only as a disease, but a really intractable disease, right, is leading to all this misconception, which is really extending the suffering of people who have morbid obesity. So not only society is blaming them for the morbid obesity, but they themselves are now believing they are the ones to blame, and they're not seeking treatment when they should, and therefore they're prolonging their suffering. As you very well know, Kamal, of the people who are eligible for bariatric surgery in our country, only about 1% are actually coming forth asking for this treatment. Can you imagine any other severe disease that would have this low level of penetration in the society in terms of its understanding, right? What the outrage would be, and yet we're okay when it's obesity. So definitely we want to shift the conversation about obesity, not as something that is related to appearance, convenience, looks, to something that has to do with the health of the person.
Welcome to United TV. I'm your host, Kamal Arkan. This person, she's Miss National American Alabama. So she's part of that. Again, you know how these topics are so sensitive. So they're actually, they know that she was not Miss Alabama, but they didn't mind, media didn't mind just putting this out there as if she was Miss Alabama, and there were some corrections came. But when I look at this lady, I see a huge problem. I see a very, very young person who is probably having so many issues in her life, day to day, from the health, wellness, and other things related to that. And this person needs help, yet we are actually spotlighting her, putting it in under spotlight, and then just saying that, look, actually, this is not only it's not a problem, but let's just celebrate how beautiful she is. That's really scary. So I'm 50 years old. You're a little bit older than I am. We can process this in different ways. But a young person, I look at like 16, 17, 19-year-old teenager, how are they going to process this information when they see this? That's kind of like where we need to really actually focus and explain this from the medical perspective, Dr. How, like when you see this, what was your reaction?
So my reaction obviously is in a way similar to yours, meaning that when we are celebrating and elevating somebody as somebody who is going to be an example to others, we want to be very careful about what we are presenting, right? Now, if you look at the National American Miss Award, they emphasize other qualities beyond appearance as important to them in awarding that. And this young lady may well deserve that. There's no question about that. And I applaud, obviously, her efforts, right? But we have to be very careful in our promoting obesity as a beautiful thing to which people should aspire, because as you correctly said, you are promoting a disease state, right? It is very important to understand here that there are some chatters, in the internet who blame this young lady for her obesity. That is something that obviously is very important to expose, right? Because obesity is not a choice. The reason people have obesity is complex, a lot to do with their biology, with their genetics. Of course, the environment plays an important role as well, but it's not simple. It's not simple as saying, okay, this person is obese because they made XYZ choices, right? The environment has a role in it, but the genetics are really the driving factor, and it's very important to understand that. So castigating this young lady because of her obesity should not be the first reaction. First reaction should be, she should be seeking treatment, right? Because this should be seen as any other illness. But try to say, oh no, this is the way she is, and we have to celebrate it as something others should aspire to, that is really not only wrong, but it is harmful. Because as I said, Kamal, right now, obesity is probably the #1 public health problem in our society. The latest figures show that the level of obesity in the United States has reached 40%, 40. This is obesity, it's not overweight, obesity, right? Which means that the rates of diabetes, the rates of high blood pressure, the rates of sleep apnea, the rates of cancer, unless we do something to control this.
So this is a really good graph to diagram to explain how serious this problem is, Dr. Gal.
Absolutely.
Normally, I don't share. We don't do screen sharing anymore. But this is a good one to have. This is where we were in the 90s, and then this is in the 2018 timeframe.
Absolutely.
And people with 30 plus BMI, and you don't need any explanation here.
Yep.
So
Absolutely.
this
Absolutely.
is how severe this problem is. Like 35% of the population in these countries with purple are over 30 BMI.
Yep.
And the red ones are, this unfortunately includes Delaware.
Yep. Yep.
That's 30 to 35. This is a very scary picture.
I want you to actually bring it back one more second, Kamal, because this is really a very important slide. Within the span of 3 decades, right, 1990 to the 2020s now, right? Mm-hmm. What we see is that in 1990, there was no state that is colored red, right? Not even yellow, right? In 1990, which means that there was no state.
Mississippi with 15 to
19%, right?
Only one. The rest of them under 14%.
Exactly. So there was no obesity rates, right, of 20% in 1990. Right now, if you look at the map, there is not a single state which has a blue color. This is 3 decades later, which means that all states have an obesity rate greater than 25%. Many of the states have an obesity rate between 30 to 35%. and several of them have obesity rates greater than 35%, which is 40% essentially, right? So with this level of incidence of obesity, we should all be alarmed, because the next generation, this coming generation essentially, may well have a life expectancy which is lower than the previous generation. This is for the first time, right? All throughout the last century, every generation increased its life expectancy, right? This generation may have a lower life expectancy compared to the previous generation, precisely due to obesity, because obesity is carrying with it all those deadly diseases like heart disease, stroke, high blood pressure, diabetes, and cancers, right? So with that in mind, we absolutely have to be careful about not promoting obesity in any positive shade whatsoever.
We want to discuss why patient needs to join the support group, what are the benefits, what they're expecting from the support groups. Sorry, I just hit my camera by mistake. So we just want to actually better understand what are the benefits, and if we can just start introducing what our support group does and why do you tell your patients to join the support group?
Sure. So our support group is basically the only physician-run support group in the state. Support groups could be run by different people. Sometimes it's run by dietitians. Sometimes it's run by patients. We also have like a Facebook support group. But in our case, our Zoom support group, which used to be live prior to COVID, is run by me or one of us physicians. The main reason we have the support group is because, we operate on your stomach, not on your brain. And so there's a lot of things that kind of play into trying to become successful long term. And it's also important to remember that, it didn't take a year, a month, a day to become overweight. It took years and years and years. And so there's a lot of learned behaviors that we have. And then when we do the surgery, we want you to be successful. So then there's a lot of unlearning that we have to do, and then new learning. So what's the best way to do that? The best way to do that is to give you information, but then also to hear from other people how they're coping with things, how they're adjusting to things, because they're living it every day, right? And so in a support group, you could do this and exchange ideas, exchange thoughts, discuss how you overcome difficult problems, how to overcome simple problems. And then everyone is there for each other to make sure that you're successful.
So now we have two different setups for the support group. One actually is the Zoom meetings, which now we have on every Tuesday at 5 p.m.
Yes,
So
first Tuesday of the month.
Yeah, first Tuesday of the month. And then you are running those, and then you sometimes bring other physicians, not from the bariatric side, but from like plastic surgeon was there last time.
Yeah, we had a plastic surgeon in May. Another time we had a psychologist to kind of talk about how to overcome behavioral issues to become more successful long term.
So this setting in terms of privacy and all that, in a Zoom meeting, how do we actually make the patients comfortable who are participating, whether or not they want to use their real name, how they're getting this, invitation, and what's the participation from your side? Like, do you see a lot of people actually coming out and telling you what they're going through? What's that setup?
So number one is, what is said in support group stays in support group. That's our number one rule. So unless it's something that's generic where you could share it with other people, we really want it to be private, what other people share with you. So in order to do that, you could be anonymous. You don't have to turn your camera on. You could put your nickname on when you register. And the main reason why is we want you to be comfortable. We want you to be able to feel free to share your thoughts, share your ideas, share your fears, share your gratitude. And the best way to do that is by making you comfortable. Okay. And so if comfortable it means don't turn on your camera, then don't turn on your camera. Okay, we could hear you. If comfortable means don't put your real name on there because you don't know if someone that you know is also on that support group, then that's fine also. So the main thing is making people feel comfortable so that they can share.
So in terms of the long-term, well, actually, before I go to that, I want to also make sure that our patients and who are actually watching and who may become part of our program, we have a Facebook support group as well. That actually is a little bit different than the support group Dr. Wynn is running. That's between our patients. We do approve the patients when they want to be part of that. It's a private group. And we do monitor this to make sure that patients are following the guidelines and they're not promoting anything that's something that people want to see. So it's just sharing their experiences, sharing their challenges, successful outcomes, and asking each other different recipes and this and that. And I see actually I get notifications because of the support group, and I see a lot of patients posting their before and after pictures, just like the last one that I see, one of our patients who lost 180 pounds in 1 year. So, and it's not like it's an exception in this case. We have several patients who are losing more than 100 pounds on a regular basis throughout the program. Now, you said something very important. You said it takes a long time to get to the level of that morbid obesity, that one of the reasons that support group is needed, because it built up for so many years with the habits and with how our body is processing things. Now, for the long-term success of the bariatric surgery, what's the support group's role in that? How do you see that?
So, we always say to err is human, right? And we are all human. So we have our good days, we have our bad days. And the support group is important because it helps us share ideas with other people that are going through the same thing. And so when you have your good days, you get a lot of support and encouragement. When you have your bad days, you have people that encourage you and lift you up, that are there to kind of give you ideas on how to overcome these obstacles, overcome maybe bad thoughts, overcome, when you've kind of fallen and you need help getting back up. So, life happens, tragedies happen, stress happens, kids happen. There's so many different things that play into reasons why we eat poorly or fall back into bad habits. And support group is there to kind of help us maneuver through those stresses, through those things that kind of pull us back down, to help us get ideas of how to overcome and kind of push ourselves back up.
Mm-hmm. Now, as I was listening to you, I see one of the new posts from a couple weeks ago, maybe, person post, and I'm of course not going to mention their names. Good afternoon. Has anyone had the bypass surgery at the outpatient procedure, as an outpatient procedure at the surgery center? So, and then I look at the comment, and we didn't respond to that from the administration standpoint. And I see our patients responding. One says, yes, I did it 3 years ago. Dr. Peters did a wonderful job. The other one says, I had mine last month with Dr. Gao, did not take any pain medication. And the other one says, had mine a year ago. Nurses were very attentive and made sure I was walking and drinking water. I mean, it's amazing. Like,
Yeah.
we're not telling these people to do this. They want to do this. So that's kind of like there's a really strong bond. And that's because I guess they know what they're going through, and they want to be able to support, not only support themselves, but support each other, so that other people can actually benefit from their experience. So from that point, I also see this really important for our patients. Now, what are the most common questions do you get in the support groups?
So, it's interesting that you just brought up that topic, because there's a lot of people that have not had surgery yet that come to support group. And you could hear all the different fears that they have. And so the best thing is hearing it from a patient that just had surgery a month ago, 2 months ago, 3 years ago, to tell you, oh yeah, I had no pain. Oh yeah, I felt great. I was surprised at how good I felt afterwards. It wasn't as hard as I thought it would be. Or even like the diet, the pre-op diet that we put everyone on to shrink their liver. Once they kind of hear it from other people, like, yeah, it's not that hard. Once you get through the first couple days, it feels great. So a lot of like the most common questions are the people that are about to have surgery that are scared and concerned about, am I going to have a lot of pain? How hard is this going to be in the first, few days? So that's really the most common questions. Later on, it becomes, I've had surgery, several years ago, and I'm trying to get back on track. How do I do that? What information? How did you guys overcome? So those are really the most common questions that are asked in support group.
I know you brought the plastic surgeons a couple of times to your support group for the Kriyas. Now, that's one of the, I guess, also another common questions, because there's one, after all those great weight loss, one issue that they may see is the excess skin. How do you actually address that in this support group? What do you tell them?
So one is we did, by way, record that plastic surgeon support group so that if people wanted to see it, they can. But plastic surgery is one of those things where people feel the need to feel better about themselves. Not everyone needs plastic surgery, and actually, in fact, only 20% of people actually end up pursuing plastic surgery. But the nice thing about support group is it's a good way to hear about how you feel about yourself, how to go about getting plastic surgery approved, what are the things that you need to do, what is the criteria, without necessarily having to make like an office visit, right? So then you could actually realize like, oh, do I have these issues? Am I going to be a candidate for it? The plastic surgeon showed us like really amazing pictures of how you go from one to, having all this excess skin to being, super svelte, I should say. It's almost like a work of art. And I think seeing those pictures and seeing the reasons why things are done certain ways and what could be done is also very inspiring too for our patients.
Now, in terms of educational, like the educational aspects of this, are you providing any resources for them in the support groups?
So we haven't done necessarily provided resources. What we do is we share ideas, and patients will give like real life resources. Mm-hmm. In that, a patient will say, well, has anyone tried a good protein drink, or how do I get my protein in? And everyone has a different idea or tried a different product, and we'll share what products they have and talk about that in support group, which helps propagate being compliant with your protein, being compliant with your vitamins, online tracking of your nutrition, different things like that help people kind of just have tools to be more successful.
In terms of like building relationships with others, what do you see among those patients who are participating?
So I think what the support group does is it builds a strong community of people that are willing to help each other. At times, on and off, we've had patients that had surgery like years ago that have been super successful, and they come to support group just to inspire others. They really just kind of have such a positive experience that they're so excited to share it and help others be as successful as they are. Another thing that happens in support group is it's almost like a buddy system, right? So you have people that are feeling like, you know, I don't have a family that supports me, or I don't have, you know, a friend that supports me. But when I come to support group, I have a buddy there. I have people there that are there that kind of understand and help me through.
And that's important because again, unfortunately, in some cases, we may not get the most support from our family members. They may not have the same education level, same struggle that we are going through. So in those cases, having someone where you can trust, and then knowing that they have no horse in the race, so that's probably just making it easier. And again, there's this really psychological part that's very important. Dr. Wynn, from the accountability and motivation standpoint, and this is kind of related to the person that they get, like a bariatric buddy, we can call them. So in terms of accountability, how do you see the role of support group in that? Are the patients more accountable because of the support group?
I think the more successful patients tend to go to support group, tend to do their follow-up appointments, and they feel like they are more accountable, right? Because they do all these things. And when they're held accountable, then they tend to be more successful. For instance, like I have a patient that comes to support group all the time. And then she also comes to her follow-up visits like every 3 months, even though she's had surgery years ago. And the reason why is because she feels that being held accountable is what helps her be successful.
Right. And that's also important for other things that we do in life. Now, when I do this session with Dr. Erga, one of the things that we have tried to emphasize, and I do that a little bit more than maybe he does, is like people who are not going through the bariatric process are doing a lot of things that patients who are going through the bariatric process, or they either had their surgery or they're going to have their surgery. Now, you are also one of those examples. You are extremely active, and I know you are eating healthy. How much effort you put into your wellness so that patients can kind of relate, because this is not, something that only patients who are going to have bariatric surgery needs to do.
Yeah, so that's funny that you say that, because that's probably why I love this job, because it's all about preaching wellness, right? And wellness is a lifestyle. And it's not something that you do just to lose weight. It's something that you do for longevity. It's something that you do to feel good every day when you wake up, and to feel like you can wake up and feel good, versus just, laying in bed all day and feeling terrible and lousy because of what you ate the day before, things like that. So I spend a lot of time reading about longevity, about wellness, about eating healthy, about exercise. And then I spend a lot of time also practicing. I eat plant-based. I preach eating plant-based to my patients, and eating wholesome for those people that don't want to be plant-based, because it's really important that you kind of look at your whole lifestyle, right? It's a life change when you have weight loss surgery. And it's really, now that you're starting to feel better about yourself, it's improving your gut microbiome. It's improving your cardiovascular system. It's, starting to improve your muscle mass, your bone density, all those things that are going to help you live a long, healthy life. So, yeah, it's basically, one of those things where, like, from the time I wake up till the time I go to sleep, I think about everything that I do in my day that's going to help me just eat better, stay active, that kind of thing.
Well, I mean, you are one of the best surgeons out there, not in Delaware, not in the United States, probably in the world, in bariatric. You have 3 kids, you have a full-time job, and I see some of the, like, sometimes I have a little bit difficulty following what you are doing. I'm like, oh my God, like how is she doing it? So we can always find excuses. So, and I think that's important for our patients to kind of hear that. Like, it's easy to say, well, it's raining, I'm not going to walk today. Well, the raincoat will just do the job, but you just don't want to walk. Or it's cold, but if it's cold, then put gloves and put a hat, and then you still need, because we are not saying that you need to kill yourself while you are exercising, you just need to stay active. And that is the lifestyle. So like, if you know that you need to walk 45 minutes into like 25 minutes each in the morning, in the afternoon, trying to keep things healthier, effortless, but still require planning and effort. So, and then if you are able to do what you are doing with all the responsibility that you have, we have no excuse. So I tell people that this is what it is. So we just need to understand and then see the good examples and follow them. Dr. Wynn, anything you would like to add before we close? What would you like to tell the patients so that they would remember to just join the support group?
So, yeah, the support group is a place to get ideas and share ideas. And everyone is there because they've been in your shoes at one point or in another. Mm-hmm. And so it's there to support each other, but it's also there to develop ideas and to kind of help you through life and life's challenges. And also, if you're about to have surgery, to find out more from other people, or if you've never had surgery and you're thinking about it, to just hear from other people what their experience is, so they'll help you overcome your fears, your anxiety. And our goal, whether it's support group, whether it's weight loss surgery, whether it's just being a physician, is to help you live a long, healthy life and enjoy your life while you have it, because we're here for a limited amount of time. So maximize the opportunity, right? And the best way to do that is talking to other people and hearing their experiences.
Absolutely. And we have the platform for that. So it's a very easy one to reach to those events on CREA's website. Our patients can sign up for Zoom and also become a member on the Facebook group. And we also do these sessions, and then the reason we are doing it is because we know that this is part of the support. And in many cases, people know already by now that we are repeating some of our topics on a regular basis. And that's because this is so important, and it's not easy to overcome. And that's why we are here every Friday to provide these extra resources for our patients. Having a surgeon in these events, any of the clinical events that we do from United Medical side and from the CREAS and American Surgery side, we do it with providers, licensed providers, because this is not about promoting our program or some commercializing our program. This is about healthcare and well-being. And hopefully our patients can find these helpful. And then we are going to be back with another episode next week.